I just want to say one thing about not just this clinic, but community clinics in general I have around my district. I don't know where we would be without them. And they do a wonderful job. They are, you know, tireless workers. And I don't say that because I'm here. I've toured this facility and other facilities before. And in our bill, by the way, you'll be happy to know if we can get it through. We've increased some funding for the VA, clinics, and also for expansion and for development of new clinics, because, you know, how many patients a year do you see here?
Currently we have over 8,400 patients.
8,400.
We saw 32,000 medical visits.
32,000. So I appreciate everything that you do and your staff, and they work so hard. So I feel like I'm talking around here, so I'll try not to hate to have my back to people. But I wanted to talk a little bit about the bill that came out of the House, or that came out of our committee, and then just open it up for questions. And there's a couple people here that I want to introduce you to and have them tell you why I think we need to move on this. Everybody says, what is the rush? We've been trying to do this. As a nation, we've been talking about this since Harry Truman was president. So I don't think this is, you know, and 15 years ago, under the Clinton administration, there was talk about health care reform. 10 years ago, we tried just to even get administrative costs under control in terms of health care by standardization of some forms, and you would have sworn we were going to tear down every building that had a hospital associated with it. But we have people here today, and I want to just introduce them. Where are they at? So I can make sure that I'm introducing the right people.
Samantha. I'm Samantha Bright.
Okay.
I probably introduced our guest.
Okay.
Chief Marketing for CHIC. This is John Tipsford.
Hi, John.
And this is Selena Dabner.
Okay. You know, I appreciate your comment. If you know, if you wouldn't mind just telling your story, and I think it puts the reason I do this is because it's easy. You know, I can come to town and say whatever, but these are people who have experienced healthcare problems and problems with the current healthcare system, and I think it's important to hear from them and to put a face behind what we're trying to do. So, thanks for sharing your story with us. And
I'll go first.
Okay.
Okay. First of all, I'd like to thank you for inviting me. But my problem with my insurance is I'm self-employed. I have been self-employed for over 25 years. My husband was ill for 6 years with colon cancer, died 3 years ago. And while he was sick, we ended up going on COBRA insurance, the COBRA. Well, that cost us close to $900 a month. Well, I wasn't sick, so I said, fine, we drop me, just pay yours. And that's what we did. And then eventually he went on disability. Well, I couldn't get on disability because there's nothing wrong with me. My thing is, like I said, he died 3 years ago, is that I've worked all my life. I've never asked anybody for anything, nor him. I raised my son, and he's grown and gone and has a family of his own. Now I'm here by myself, and I can't afford the insurance. If it wasn't for Decatur Memorial Hospital helping me and the CHIC Clinic, I don't know where I'd be. Right now, I owe over $5,000 worth of medical bills to DMH. You know, 61 years old, what do you do? What do you do? And then there's someone in front of you at the doctor's office that's got a medical card that their bills is automatically paid with my tax money where I'm paying taxes. I'm paying for their bills. Who's going to help me? You know?
Thank you.
I'm angry.
I don't blame you. You should be of every reason to Jeff.
Me, I'm unemployed, and when I lost my employment, I lost my benefits, and if it wasn't for CHIC, I'd really be in trouble, because I'm on 12 different medications for my heart and my diabetes, and I'd be in a world of trouble if it wasn't for CHIC helping me out.
Well, as I said, I thank you for what you do for people every day. You know, and let me just give you a brief overview of the bill as I know it. Now, I want to start off by saying one thing, and then two things, and then I'll go into the bill itself. First of all, people have asked, did you read the bill? And the answer is yes, every page, every section. The reason I can say that is that we started marking up our part of the bill at 10 o'clock in the morning. We worked through the night until 6 a.m. the next morning. We adjourned for 2 hours and came back and finished up 3 hours later. Then we had a 9-hour caucus meeting going section by section through the bill. So I haven't memorized every section, so I do have my cheat sheets here. If you have questions, I can refer to a section. But I can tell you what is in the bill, what is not in the bill on the House side. Now, what I can't do is tell you about the Senate. The problem with that is you've had 7 senators who have been sort of secluded in a room, I guess, and talking about it, trying to hammer out a bill. And I agree with Senator Durbin. It's frustrating. He has no clue what they're talking about. So when I talk about this bill, I hope you'll understand this is strictly the House version. And when the Senate comes out with the bill, whatever it is, they'll, assuming we can get this passed and they get theirs passed, it'll go into conference. So this bill will likely change. I hope not much, but I can't promise you that I won't come back and tell you what I said before has been removed or altered a little bit from the bill. I hope not much.